I'm Troy Kirby with a quick look at the 2022 Washington State legislative session. The Senate Health and Long-Term Care Committee heard public testimony on SB 5660, which would allow access to individuals 21 years of age or older to psilocybin services. Psilocybin can be classified as LSD, psychedelic mushrooms, or other properties currently registered as illegal at both the state and federal level.
After the Blake decision, and I was looking at Michael Pollan, who's an author, he's been a journalist for a very long time, and late in his life, he started getting into this psilocybin research, and he talks about his own personal use and how, and just kind of walks you through that experience. And I thought it was pretty amazing.
I just want to make a couple points about psilocybin regarding its safety and its importance. The science tells us that psilocybin is very non-toxic. It's also not addictive. In fact, it might even have anti-addictive properties, and it's showing great promise to help people stop smoking, stop drinking alcohol, and stop using other substances like heroin and other opioids.
While I am faculty at the University of Washington, I'm here today to speak as a private citizen. And for that, I'd like to support the bill for SB 5660 with one caveat. So first, the evidence currently suggests that psilocybin, when given in a controlled environment under the care of a provider, may significantly reduce symptoms of depression, anxiety, trauma, and a range of substance use disorders. Despite the confusing history, these compounds are incredibly safe and non-toxic, as Dr. Mark said. They're non-addictive and may help they may help some people find significant relief in a setting of disorders that are increasingly fatal.
We are healthcare professionals who support State Bill 5660. Based on the results of rigorous, randomized, controlled trials, the FDA has designated psilocybin as a breakthrough therapy, indicating that it represents a significant improvement over existing therapies. Psilocybin has particular value for military veterans struggling with PTSD. Nonprofits currently have to spend $4,000 per veteran to fly them out of the country to get this treatment. This bill would let them get treatment in Washington state for a fraction of the cost.
Notably safe, according to NAMA, and the North American Mycological Association toxicology reports and poison case registry. From 2017 to 2020, there are no poisonings reported, no deaths or hospitalizations that occurred with psilocybin-containing mushrooms. In fact, over the past 30 years, no deaths were reported, and only over the past 30 years, 103 cases needing hospitalizations were noted.
2 years ago, I had to close down my business. I was the chef owner of a little neighborhood restaurant called Tilth in Seattle, and I had to close it down due to the pandemic. But before then, I was thriving. I had other restaurants in the past. I've hired hundreds and hundreds of, people, and have done a lot of things for my community that I live in and that I love. And it really was psilocybin that has helped me with my anxiety and depression getting through this time, and, helping me continue to be an entrepreneur, continue to, hire people and be a high contributor to my community.
My team is the first team to provide legal psilocybin mushroom group therapy in North America under an exemption from the Canadian government. And as an MD, what I would like to add, and I agree with what all my MD colleagues have already said around the safety, but as an MD, to be able to provide this therapy to our patients and to see the profound changes in them, decreased depression, decreased anxiety, decreased substance use, decreased tobacco use, decreased suicidality. These profound changes in our patients are why we MDs go into medicine. This is the change we hope to do.
I'm here to say that psilocybin saved my life. I've had depression since I was 10 years old, and that's over 20 years of agony, at times with constant suicidal thoughts. 20 years of over 30 medications and countless treatments, including electroconvulsive therapy, all of which left me with permanent side effects, and none of which actually helped. I had to give up my career, go on disability, and rent out my home, all because of depression. Then, as a last resort, I tried a psilocybin retreat in Jamaica where it is legal. After just my first dose, I felt like myself for the first time since I was 10. I found beauty in the world. I found a strength inside myself. And I was really smiling for the first time since I could remember.
I do believe that it would be very important to do some social justice around decriminalization of psilocybin, in addition to what we're doing here, because all of the things that we've been talking about are all of us who have had these experiences, myself included, we all did it illegally, but we had profound experiences. And so we should make sure the people who, where that really is a big barrier, that we don't have that anymore.
As a therapist who specializes in working with people with complex PTSD, and as a trauma survivor myself, I can personally attest to the benefits of psilocybin for mental health. I have watched many clients move from being stuck in their trauma, depression, and anxiety to feeling a sense of ownership and choice in their life through their intentional relationship with psilocybin.
Thank you for watching the 2022 Washington State Legislative Session.